I was recently strolling through social media and I saw this topic come up about the topic of outside clothes on the bed. Now, we know as nurses, we strip at the door. Why do we strip at the door? We strip at the door because we work in hospitals with patients that have bacterias, bodily fluids, and we don't want to bring any of that into our homes, to our families, to our kids. And what I want to do is I want to start a conversation in the comments about this. I want you to drop your comments about this topic because I think maybe our, we become like hyper vigilant about bringing bacteria into the home, especially with all these crazy viruses going on out there. So, and sometimes maybe our spouses think, or our families think that we're obsessive compulsive, right? When it comes to dirt and things like that, and touching things and washing your hands. So, drop me a comment. Let's start a conversation because I want our viewers to see why. Drop some conversations about the things that you see in facilities and hospitals with patients about why you strip your clothes and why. And actually, the topic was actually outside clothes on the bed. And coming from the hospital, I mean, I don't think any nurse will ever come in from the hospital and actually jump into her bed or his bed with their hospital scrubs on. I mean, most nurses want to strip at the door and don't even want to bring their sneakers in the house and walk through their house, which is why when we go to the hospital, when we are in the hospital and we see people bring their kids and they're crawling on the floor, you don't know what kind of infections on the floor. People have staph infections and they have VRE, which is like like vancomycin resistant enterococci, which is a resistant bacteria, which means that those bacteria we don't even or staph resistant bacterias staph infections which are resistant to penicillin. So we know, and so that means when you get these infections, a lot of times they're hard to treat. These infections are hard to treat, right? When you get them, the antibiotics, it takes multiple antibiotics, and then people end up with other problems when they're on these antibiotics. And the last thing we want to do is acquire this or give it to our family. And a lot of times as nurses, we know like these staph infections are acquired through the nasal passage, right? Sometimes. And so that's why we wear masks in the hospital many times. And sometimes we can't even, you can't even, you're just a ticking time bomb walking around with these bacteria. Now for me to bring this on my clothing and bring it and bring this filth into my bed or into my house, to my children, to my husband, to my family. No, 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 no. So drop me a comment. Let me know if any of you get resistance from family members about how obsessive compulsive you can be when you work in the hospital. Just wanted to talk about this. I was watching like I said, another influencer, and it was nothing related to nursing. And the young lady in the video kept saying, "How could you bring outside clothes into your bed?" And I kept thinking, boy, she must work in the healthcare industry for sure. Well, anyway, this was just a quick rant to start a quick conversation with you. Drop me a comment about your thoughts when it comes to this. I know what my thoughts are. The thoughts are strip at the door. Do not bring those clothes into the house. They go into the wash immediately. Sneakers do not go through the house, or your work shoes are not for walking around in the house because you don't know what's on there. Imagine, just imagine bodily fluids all over the floor in the hospital. You can't see it. It looks like it gets cleaned up, right? And don't stop letting your kids crawl on the floor in hospitals, airports, in public spaces. Please stop letting them do that. All right. Thank you for joining me on The Broken Shift. My name is Natalie. Hit that like button, subscribe, and I will see you in the next one.